So artificial intelligence has been with us probably for 20 years or more, and we don't even know that behind the scenes we've got intelligent algorithms doing everything from interpreting our blood tests, helping radiologists look at CT scans. There's a reason it's called computerized tomography, there's a C in there. So the technology for making diagnoses, looking at large data sets, that's actually bread and butter already, and it's just simply not noticed, it's in the background. What I think we're going to start to see more of is that patients themselves will begin to engage with intelligent systems. It's common, or let's say if you've got depression or anxiety, you might go online to do a course to help you manage your symptoms. That in the future will be not just typing into the thing, but talking to a chatbot, a face that will look at you, will recognise your own emotions, you respond to. So I think it's going to come from back of house to front of house pretty soon. I don't think the technologies are changing. It's just that our capacity to adapt to them is now at a point where we're much more willing to do that, I think. The big strength for most AI is around tasks where you have a pattern and you can recognise it. So that classically is diagnosis. So if you're a radiologist who's looking at pictures, or a dermatologist that's looking at skin lesions, those are the sorts of tasks that maybe in 10 years' time will be done by standard with computer and maybe having a human check on what's going on. For really, I guess, the last 30 years, though, we've also looked at areas like therapeutics, making recommendations about what is the right drug. If you're having radiotherapy, there's already a computer helping the radiotherapist plan where the radiation will go. So there's a lot of work on the role of intelligent systems in planning how to carry out a therapy, what are the right options, and maybe making changes as things go along. So I do think it will be across the board, but there are some places where it's obvious and easy, like diagnosis, and there are other places where it's a little bit harder. So it's just a question of timing. General practice is a really important part of healthcare, and it's where touch and engagement are really important. But still, general practitioners face huge knowledge challenges. Which drugs do I prescribe? Do these drugs interact? Are these the right drugs with this patient with this disease? To be able to know all of that is very difficult. As knowledge keeps on changing, there are new results all the time. So the most obvious place where a GP will be using a computer is in prescribing, and already today it's standard that system will have intelligent software behind it to help GPs decide whether or not to prescribe a particular drug. That will extend to being able to suggest whether or not to refer a patient on, to help you decide what the right tests are to order if you're not going to refer on. So I think the whole notion of primary care is around being with people and being the doctor for a patient. But the intelligence will simply make GPs far more effective and efficient and safer.
So you don't see artificial intelligence replacing GPs?
I think healthcare is very interesting in that there's much more demand than we are able to meet. So I think every doctor, every nurse who's out there is working full tilt, and if they could work twice as much as they do, it would still not meet the demand. So I guess what's going to happen is that AI is going to make everybody capable of doing more than they currently do, maybe meeting some of that demand that's currently unmet. I think there are lots of challenges. One is simply the willingness of us as consumers or patients, or as doctors and nurses or other allied health people, to get on board. In other words, are we willing and active adopters? Often people are reluctant adopters, and I can understand that reluctance. On the other hand, if you want to be as safe and effective as possible, then maybe the best option is to be assisted by technology. It might be that in 5 or 10 years' time, when you go to court and there's a medico-legal issue and a patient was harmed, the question might be asked, did you use the assistance that was available to you on the computer? And failing to do that might be failure to meet a standard of care. So those sorts of things will drive it. I think we are still very bad at rolling out healthcare IT in general, and we're not talking about intelligent systems here, we're talking about making sure every record system in every GP practice and every hospital can share records between them. You would think in 2017 we can do that, that is an issue not of technology, but an issue of government and willingness, the way that the health business works, the way the IT industry works. So these are business and cultural issues that will impede, I think, the rollout of more sophisticated systems. It's inevitable that these technologies will continue to roll out. As I said, they're already here. We don't know necessarily that they are there, but they're doing their job. What I worry about is making sure that these are safe systems and that these systems will not make recommendations that are inappropriate, or that in fact people will not use them safely. So when you're making a decision that involves the care of a person, there's a risk of harm if you do the wrong thing. And if you over-depend on technology, for example, that might make a decision that you would have made go one way, go the other way, and harm the patient. We currently have no regulation around the design of clinical software at all, let alone intelligent systems. And it seems to me that in 2017, that's a failing, it's a national failing, and I would love to see concerted effort to make sure that all of the systems that are produced and are used have been certified to be safe.